Hi, Dr. Edwin Williams, a facelift specialist, talking about facial rejuvenation today at our Fireside Chat. So thanks so much for watching. Question we get a lot is, what is the difference between a facial or a peel? Or say a microdermabrasion and a peel? Why would one have a facial, or why would one have a chemical peel over a facial? So let me just explain the difference between the two. Peels, what they really do is it's a chemical peel, but it's put on a very specific layer. Peels can be done by estheticians, but the deeper the peel, the more that it has to be done by a medical professional. So I don't want to really get into percentages. Typically, glycolic acid and some of the alpha hydroxy acids are done by estheticians, but as you start to step into the trichloroacetic acid or more medical grade peels, they need to be done by a registered nurse. In fact, a 35% TCA peel is something that really a doctor should do. It's not something you should really be done by an esthetician. So that's really the difference. What does a chemical peel do? Let's talk about a medium depth, maybe 20-25% trichloroacetic TCA peel. What does it really do? It breaks or dissolves the bonds between those cells that are migrating close to the surface and allows that skin, the dead skin, to come off. And that is really what gives us a more rejuvenated skin. Actually, microdermabrasion can do a little bit of that, but the big difference between a chemical peel and microdermabrasion is as you start going deeper, chemical peels can actually cause an inflammation, which causes the body to lay down collagen and tighten the skin. That's not going to be seen at the lighter peels. That's going to be seen as you get into a darker peel. What does it result in? Skin that is smoother, brighter, tightened pores. Fine lines get improved. Again, the deeper you go, the more likely you are to get a little deeper wrinkles and reduced and even skin texture and tone. One of the byproducts is you also, some of the uneven pigmentation we call dyschromia, bad chromia color. So uneven staining, skin staining, those things are treated by the medium depth peels. They take about 10 or 15 minutes, and you can either have a 2 to 3 day recovery with the lighter chemical peels or a more significant recovery, more like 4 to 7 days when you start getting into deeper peels. So facials are really done in the spa type setting by estheticians. Nothing wrong with them, but it's really a deep cleansing, get some of the dead skin off, just like microdermabrasion. But as far as lasting results for hyperpigmentation or uneven pigmentation, we really transition into the peels, and they're a little more effective. So I hope that answers some of your questions, but really what I would recommend is seeking the opinion from an experienced chemical peel professional. I've been doing chemical peels for 25 years. It's somewhat of a lost art, and there are a lot of lasers out there, but there are certainly times when a chemical peel does a better job for uneven pigmentation and wrinkling. So good candidates for peels, typically people with sun damage, large pores, wrinkles, either fine wrinkles, rough textured skin. And the results that we see in longevity is there. In other words, if you do a chemical peel and you get some wrinkle reduction, you're basically moving them back on the conveyor belt, and you will get years of improvement over that. It's not a temporary thing like a facial or like a microdermabrasion. So chemical peels done correctly at the right depth do have longevity, many, many years. Those changes that are in the skin are basically permanent changes. So that's basically it. Difference between facials, microdermabrasions, and a chemical peel. Chemical peels, again, at a lighter level, can be done by estheticians. 10%, 5% glycolic alpha hydroxy acid, but as we move into the deeper peels, they really need to be medical grade. So I hope that answers your questions on chemical peels versus facials. I really appreciate you watching our video. Thanks so much. Check us out on williamssurgery.com.